Decriminalization: the decriminalization of drugs in British Columbia.
We are here to inform those who are against the decriminalization of drugs about the benefits of this policy.
What is this policy? Let's go into detail. This policy is about how much of the legal drug the user can carry and legally use. Just to be clear, anyone under the age of 18 can't use any drugs covered. Drugs that were banned before are still banned. What does this policy cover? This policy was stated on January 31st of 2023 and is effective till January 31st, 2026. Policy covers heroin, fentanyl, crack, powder cocaine, meth, and ecstasy. The person possessing the substance can only have 2.5 grams on them or less. If caught with more, there will be repercussions. But if caught with the above substances and less than 2.5 grams, they will be given information for social support and recovery services. What remains illegal? Any amount of drugs not listed in the policy, more than 2.5 grams of drugs listed in the policy, having any amount of drugs on school premises, in a vehicle or watercraft. These drugs are not legal to sell in stores.
Stigma towards decriminalization means stigma towards substance users and marginalized communities. Afraid that drug use will become more rampant in more communities, that it may become socially acceptable to use substances in public, and that drug prices will be lowered after decriminalization, making them more accessible. Who this policy destigmatizes. The criminalization of drugs has had social and health harms that have impacted the communities of Black, Indigenous people, and people of other minority groups. It has also impacted those who use substances. A majority of these communities already face racial prejudice, discrimination, and stigma.
Why is this policy effective? It aims to reduce the barriers and stigma that prevent people from accessing life-saving supports and services related to substance use. This policy is effective because it doesn't criminalize substance users who get caught with illegal drugs. They are now offered support services to treatment for their substance use. This is beneficial to users and will help in the reduction of reoffenders relating to substance use crimes. This is because they won't be criminally charged or jailed for their use. Instead, they have access to support and services for their substance misuse, in the hope they take advantage of the treatment available. It's effective because users won't be shamed and stigmatized as being criminals. Instead, they are treated as people who may have substance misuse issues and deserve the opportunity to treatment and community health services. Who is this policy geared towards and who it doesn't apply to? This policy affects adults 18 years and older who are substance users. It affects those who get caught with personal amounts of 2.5 grams or under of illegal drugs. Instead of getting criminal charges, these people will be offered information on support to health and social services related to substance use, such as referrals to treatment and recovery centers. This policy does not apply to youth under 18. Youth 17 years and younger are still subject to the Federal Youth Criminal Justice Act. Although it doesn't apply to youth if caught with illegal drugs, the Youth Criminal Justice Act will offer rehabilitation and reintegration, which includes community, health, and counseling services.
Issues of decriminalizing drugs. The decriminalization of drugs would remove criminal penalties for drug use and possession at low levels. Decriminalization would reduce the number of people with substance misuse in prison and allow them to seek drug treatment. It will also decrease stigma. People who struggle with substance misuse are less likely to be viewed as criminals and as a result are more likely to seek treatment and recognize their substance misuse. It will also put more funds into harm reduction, such as safe injection sites. Ever since Portugal decriminalized drugs and put more funds into harm reductions, drug overdose has greatly decreased.
Decriminalization in Portugal. In 2001, Portugal became the first country to decriminalize the consumption of all drugs. In 2000, the number of people who accounted for new HIV/AIDS diagnoses was 907, and in 2017, there were only 18. The rate of new HIV/AIDS diagnoses fell from 52% to 6%. The proportion of prisoners sentenced for drugs has fallen from 40% to 15%. Before Portugal decriminalized drugs, in 1999, they experienced 369 deaths from overdose, while in 2016 there were only 30 deaths. The number of deaths from overdose decreased by over 80%.
In this presentation, we talked about what drug decriminalization is and the stigma that these policies face, including real-life examples of how a country who's put this policy in place faced exponential positive growth. For example, a decrease in criminalization. When presented with all this information, we can see how through the decriminalization of drugs, one can slowly chip away at these conglomerates, such as the prison industrial complex, who make immense profit by targeting low-income racialized communities, capitalizing on drug laws to ensure that they have a constant flux of bodies pumped into their facilities. More information/resources for substance use and mental health.
Sources: